Hi, my name is Marcia, and I'm a student at Florida State College at Jacksonville. And today I'll be doing a presentation on childhood obesity. The reason why I chose this teaching subject is because it is a topic that is pretty personal to my own life. I am an obese person, and I was formerly an obese child. I also wanted to do this teaching subject because I work in a community, a poor community, where a lot of my patients are dealing with a lot of the ailments associated with obesity. And so I feel like I can provide a unique perspective on this topic. Um, as far as obesity is concerned, and childhood obesity at that, we've all heard that, obesity is Americans, we are the fattest country in the world, and how obesity is an epidemic now. But when it comes down to childhood obesity, what we don't really hear is that, the rates of obesity among children in this country is leveling off. Leveling off doesn't mean that it is going low. It just means that it is has remained stagnant in the last couple of years. Unfortunately, these levels are still dangerously high, especially in African American and Latin communities. And so, knowing these facts, it just provides a very frightening look at how these communities can be affected in the years to come if this epidemic, if this crisis, if this problem is not corrected. So let's go into some of the risks associated with obesity. The first risk associated with obesity is heart disease. Heart disease or cardiovascular disease is basically an umbrella term for any disease that causes the heart vessels to become narrow and then blocked. These diseases can include hypertension or high blood pressure, chest pain, heart attacks, atherosclerosis, and stroke. We'll be talking about high blood pressure and stroke later in this presentation. Hypertension or high blood pressure is often referred to as a silent killer. They call it that because a lot of times there is no symptoms associated with hypertension. Basically, the person does not know that they're hypertensive. The only way that you can know that you have hypertension or high blood pressure is that if you go and have a medical professional take your blood pressure. If you're pre-hypertensive, which means that basically you're at high risk for being hypertensive, your systolic blood pressure will be 120 to 139, your diastolic will be 80 to 90. If any of these are your numbers, you can sort of breathe a sigh of relief, but not so fast. You want to make sure that you're aware that if you make lifestyle changes, meaning that you change your diet, change your exercise regimen, be more physically active, then you can basically turn things around from here. However, if your blood pressure ranges are the systolic is 140 to 159 or diastolic is 90 to 99, then you are actually hypertensive and need to manage your disease with medication. But that doesn't mean that all is lost for you as well. You still need to make diet changes, lifestyle changes, and a lot of times you can get off a lot of the medications, depending on depending on your heredity and things like that, and what your doctor has said. But all these things are very important, and it's also very important to know that there are no symptoms associated with hypertension. A lot of times people who are diagnosed with hypertension are not compliant because they feel that they feel fine and therefore they are fine. And a lot of times that is just denial. You're not actually fine. Hypertension and high blood pressure is basically the first sign that your heart is having to work too hard to sustain your life, and you do need to make a lot of changes. The next thing associated with obesity is basically a stroke. We've all heard of a heart attack, and we've seen pictures of people clutching their chest and bending over in agony and yelling out to somebody far away to call 911. They think they're having a heart attack. We've seen that on movies, we've seen that on sitcoms, we've even seen it on commercials. But the A stroke is basically the same thing. It's just a different organ. If any of the vessels of your brain become blocked, no oxygen, no blood is going to that particular area. And while it may not cause severe pain, it can cause you to become very confused. It can cause you to lose consciousness. It can cause you to have paralysis, where you're having basically you're paralyzed on one side of your body. It can even cause your immediate death. So it's very important that you follow up with doctors and basically take care of yourself if you are already an obese person. But if you're trying to prevent obesity from happening in your family, your community, this is just something that serves as basically a warning. One of the things that can happen, what you can expect if you do not change your current lifestyle choices. Now, the other disease associated with obesity is diabetes. Diabetes is basically a worldwide epidemic, and there are two types. Type 1 diabetes is where the body is insulin insufficient. Basically, the body is not producing enough insulin. And I don't really want to go into type 1 diabetes because it's not really associated with obesity. It can happen whether you're obese or not. However, type 2 diabetes is totally preventable. It is something that is totally associated with obesity and overconsumption of sugar. And so, as far as type 2 diabetes is concerned, it is insulin resistant. Basically, you've overconsumed sugary products so much so that your body is no longer responding to the insulin it makes. So your sugar that you're taking in is not going inside of your cells. It's hanging out into in your serum blood glucose, and it is wreaking havoc on all the organs in your body. It can damage your kidneys. It can damage your eyes. It can ruin your circulation, cause you to have amputations. It can also mess with your immune system. All these things can happen just from consuming too much sugar. And like I said, a lot of this, like the type 2 diabetes, it is preventable. The next disease associated with obesity is osteoarthritis. Basically, this is arthritis that is associated with the weight-bearing joints. A lot of times we think of arthritis as something that older people get. However, it is something that obese people experience all the time. Basically, the weight-bearing joints, the joints in the knees and the hips, are affected because they are the ones that bear the most of the weight. And if you're an obese person, you're carrying around more weight than normal, then you will be at a higher risk for developing joint pain, inflammation associated with the joint pain, and may end up needing a knee replacement, or you may have some issues with mobility in your extremities. Another risk associated with obesity is breathing troubles. We've all heard of sleep apnea and asthma. When either you have sleep apnea or asthma, your body, your brain is becoming starved of oxygen. If you're having this issue at night while you're sleeping, where you sort of basically stop breathing at night because of how heavy you are, it can cause heart attacks. It can cause you to have brain dysfunction, different things like that. And you're basically unaware. You're sleeping. It was when you're most vulnerable. And all of this is just basically associated with carrying on too much weight. So I want you to take some time now and prepare yourself. Take out your handout, because there will be one question and it has 3 answers. And here it is. What are the 3 diseases associated with obesity? I want you to take some time. You can pause the video here and you can come back when you're done. Okay, I'm back. So let's go into the answer to this question. What 3 diseases are associated with obesity. Now, we went over about 5 or 6 of those just moments ago. So let's see what you've written down. If you've written down any of these diseases, whether it's heart disease, high blood pressure, stroke, diabetes or osteoarthritis, or breathing problems, you are correct, and it shows that you've been paying attention. So let's go on to the next lesson. Now, as far as healthy diet is concerned, this is one of the ways that we can combat obesity by choosing the best diet possible. I want you to pause the video here because my particular UCAM will not allow me to play videos. So I want you to go into the description box and click on the link and watch that 3-minute video and come back, and I want you to fill out a sample menu. Okay, I'm back. And here is the sample menu here. As you can see, this is the My Plate menu, and it should be in your packet. If you do not have this handout in your packet, you can just basically look at what's on the screen here. But when you saw the My Plate, they show you how to basically set up all of your meals. And this not only helps you choose more fruits and vegetables in your diet and healthier proteins and grains, but it also helps you with portion control, because basically these little round circles, they are your plate, and that is how you're supposed to set up your meals every time you eat. So if you're having lunch, if you pick something like, the protein would be salmon, 4 ounces of salmon, and the grain would be, brown rice, and fruits you would have melon, and the vegetables would be like a small side salad. That would be a fabulous plate. Here would be your dairy, and if you pick things like a glass of skim milk or yogurt on the side, low-fat yogurt on the side, or low-fat cheese on the side, those are things that would fit into the My Plate scheme of things, and basically will offer you all 5 food groups in the proper portions. So let's go on to the next portion of this discussion, and that is the benefits of physical activity. Physical activity is another part of how we can combat obesity in our community. It's just best to know, not just that physical activity is great. It's just, what does it do to your body? We've heard about all the things that obesity does. Now let's look at the antidote. So weight control, we know that if you're obese, you have trouble with controlling your weight. Well, physical activity, helps you burn some extra calories. And weight loss surgeries and pills and different potions and shakes and all that kind of stuff. The weight loss industry makes over $8 billion a year, basically selling you the same formula. Basically, if you take in more calories than you burn, you're going to gain weight. If you take in less calories or burn more calories than you consume, you'll lose weight. So that's essentially what you're doing when you're participating in physical activity. You're burning more calories than you have consumed. The other benefit of physical activities is that you can reduce the risk of cardiovascular disease, and it basically makes your heart stronger. The more you exert yourself physically, it increases your heart rate, and which causes your heart to sort of build up. Basically, your heart is a muscle, and it will basically build this muscle up and make it a more effective pump. This will make you less likely to have hypertension and all the diseases that are associated with the heart. One in particular, like we talked about earlier, is the cardiovascular disease or heart disease. The other benefit of physical activity is to reduce risk of diabetes. As we mentioned before, diabetes, especially type 2 diabetes, is the body's basically being resistant to its own insulin. Well, when you work out and you exercise and things like that and increase your heart rate, it increases the demand that your body has for insulin, and your body's going out basically searching for its own insulin, and so it will be more receptive to its own insulin, insulin and allow the excess sugar that's in your blood to go into the cell and allow your body to use it for fuel. This will lower your serum glucose levels and therefore decrease your risk for diabetes. Next benefit is that it strengthens your bones. Basically, when you work out, that pushing and pulling that you're doing as you're exerting yourself makes your bones a lot stronger, makes your muscles a lot stronger, and therefore it makes the bones stronger because the muscles are getting stronger. Also, it boosts your mood. If you're participating in activities, basically, when you work out, your body releases what is called these feel good hormones or feel good chemicals called endorphins, and they reduce the immune system chemicals that cause depression. Therefore, it increases it increases your happiness. It makes you happier, increases your mood. So some of the types of exercise, and a lot of people feel like they have to go to a gym, they have to pick up heavy weights, they have to do all of these different things in order to be considered, being healthy and working out. Well, that is totally not true. Here are some of the things that can be considered exercise, and they're pretty simple. Walking, running, and running may not be for everybody. So walking, running, sports, especially when you're thinking about incorporating this lifestyle for your children. You know, children, should do extracurricular activities in school. You can get them into sports in school, dancing. Dancing is fun for everybody, and it's something that the whole family can participate in. Gardening. A lot of times when you live in a metropolitan area, in an inner city area, a lot of times you're not close to a lot of healthy food choices and food options. So gardening is a great way to not only keep your family around you and teach them a new skill, but it's also a good way to get in exercise along with getting in fruits and vegetables. So here's some more questions. I want you to take some time out and answer a couple of these questions. And this has to do with just the last couple of sections that we talked about. So the first question is, what 3 ways can you incorporate exercise into your own family's daily life? I want you to think about that for a moment. You probably want to take a little bit of time, pause the video here, and answer that question. The next one is what do you think would be some limitations of incorporating exercise? Everybody wants to be all gung-ho about, let's start this regimen, let's go ahead and start this diet, and but there are limitations associated with, incorporating exercise, and you need to think about that ahead of time, because if you don't and you get right into it, you'll be discouraged and won't want to continue if you meet any of those obstacles. So what can you do right now to sort of remedy that? So I want you to sort of think about those things right now, and then pause the video here and write them down. And those of you who have the worksheet, go ahead and fill that out now. Okay, so I'm back, and here are the answers to this. Is just some answers that I had. So, you can go for a walk with your children after school. That is a really nice activity after you've prepared a nice, healthy, sumptuous supper. You can take them all out to the park for a nice walk, and it's a good family bonding time, and it also gets that, physical activity in for the day. You can, instead of going to the movies and things, you can go swimming on the weekends. I live here in Florida, Jacksonville, Florida, and we have a beach. And this is not the time of the year to go to the beach, but it is a nice city because it's just nice and warm here all the time. And you can take your kids to the beach and swim and stuff like that, because swimming is exercise and it's also fun. And like I said before, you can also encourage your children to participate in sports. I mean, that's just one of the best ways, because they're around their peers, and you can always go out and watch them and make it a family thing, helping them practice. All of that is family fun, and it actually helps you to get exercise as well as your kids. Now, as far as what do you do, what are some limitations? Like, some people feel like time is a big limitation with, just finding the time to exercise can be a big limitation for some. Physical and medical conditions. Some people already have arthritis or already too heavy to, say, go out and do really, really strenuous activity as far as exercise. And in childcare, it could be an issue. Like if you have a very small baby who, you can't leave at certain hours, a lot of these things, as far as time is concerned, there's 24 hours in a day. You just want to be able to plan out time to exercise. And it takes some dedication. It takes some setting aside at least 1 hour a day and dedicating it to time where you and your family can exercise. As far as physical and medical conditions, it's just sort of, you want to do what is within your limits. So if you cannot do running, do walking. If you cannot do too much walking, you can do indoors, like do pool, do some swimming and things like that. It's always something you can do. Stationary bike where you're not doing so much weight bearing exercises. So it's always things you can do to remain active. And as far as childcare is concerned, like I said, a lot of that is just, you have to customize your own plan to meet your own needs, and you have to ask yourself how important this new lifestyle change is to you. So this basically concludes my presentation. I want to thank you all, whoever watched this, whoever filled out the worksheets, whoever filled out the questionnaires. Thank you very much. These are some survey questions that I wanted to basically go over with you. And you can just sort of just answer these questions and just tell me how you enjoy the presentation. So I'm going to remove my face and just put this up. But how likely were you to change your diet based on what you've learned? And if you're not likely to change anything that you're doing, just put a 0. If possibly you may change some things, you can put 1. Or if you would definitely change something, put a 2. How likely are you to increase your physical activity based on what you've learned? If you're not likely to change anything that you're doing, but not likely. If you say maybe you might want to do it, or you think you can do it sometimes, but possibly. Or if you definitely are gung-ho about doing some changes and incorporating some of the lessons that we've taught here, go ahead and put 2. How do you feel, excuse me, do you feel that this lesson was address issues that were important to your family? If you feel like, that we did not address anything that was important to you and your family, no. If we address certain things that were, important to you and your family, put number 1. Or 2 for yes, definitely. And also, how clear was the message? If you felt like, the message, the message that we were trying to impart was clear to you, was not clear to you at all, put 0. If it was somewhat clear, put 1. If it was very clear, put 2. And final question, how likely are you to pass what you've learned along to others in your community? If you're not likely, put 0. If you're somewhat likely, maybe pass along to 1 or 2 people, put 2. If you're definitely likely, then you definitely want to put 3. Thank you very much for watching the presentation. If you want to, you can go ahead and check out my references. Otherwise, thank you so much for watching this video.